Yeah, I'm Hans de Boer. I'm also a forensic pathologist, originally from the Netherlands. I've been in Australia now for 4 years, I believe, yeah. And before that, yeah, I was a forensic pathologist for 3 years already in the Netherlands.
I imagine that most of the people who are watching and listening today, their experience of forensic pathology would be in the TV shows that we watch. Is that pretty representative of what it's like presenting or giving opinions based on evidence?
I think if you talk indeed about the TV shows where people are definitely certain and we are much more uncertain, and I think that has to do with that difference between evidence and opinions. I think the evidence is the objective fact that you have, the pathology finding, the autopsy finding, but also the scientific literature as it exists. But there's always the peculiarities of the case, the specifics of the case. So you always have to interpret it to that particular case. And that's when it becomes an opinion, because that has to do with your own training, your own experience, how you weigh this evidence. And that's why, indeed, forensic pathology evidence, as given in court, is most of the time an opinion.
Yeah.
It is not something the same across the board. It is what that particular pathologist believes based on his findings and the scientific body, the body of knowledge.
What makes evidence robust so it's going to stand up to scrutiny?
I think if you talk about robustness, it is not the same as confidence. I think robust means that it holds up to scrutiny and that you think that another pathologist with the same set of information would come to the same conclusion, that it is an agreed upon position that you make. I think that is robustness. Also open to peer review, open to cross-examination, that's robust. But you can very robustly say, I do not know. So, and I think that's a very important difference, that in our line of work, you have to have 20, 30 types of ways up your sleeve to say, I don't know, because that's something you will be saying a lot in court. But that can be a very robust position. Every forensic pathologist in that position will say the same thing. Because you have the evidence that you can't say, because you have the evidence that there is no evidence. So I think that's a very important difference between indeed scientifically robust and whether you can help the court or whether you can say something helpful that is actually not important for us.
And what's the training for giving evidence? Or
Oh, that's a really good question, because being trained in the Netherlands, I worked in a forensic institute, so we only did homicides, and I was trained on a specialist expert evidence course, all those things, because we were only doing homicides. Here, actually, it's not a formal part of your training, and that's
here in Australia.
That's here, exactly. That's here in Australia, and I think that is so. You learn this from your peers, from your mentor in your department. You have to have cases that go to court. You have to be lucky with that. You have to be lucky that it's a particular case, indeed, that goes to courts. The type of case, of course, matters. So training is not so. I would say it could be done better in Australia, and we're actually looking into that within the RCPA now to do that better. So but to answer your question, you can go to court as a registrar if you feel confident, and your consultant also feels confident that you can do that. But you can also not end up in court until a couple of years after your consultancy.
It's interesting. I don't know whether it's the same opinion held by yourselves, though, but I think a lot of the emphasis in training for presenting evidence in court, from a forensic pathologist perspective, at least from my experience in training, is how to give your evidence in such a way that it doesn't embarrass you or undermine what you have to say. The informing the jury correctly and the other legal obligations are important, but they're almost secondary to the avoiding professional embarrassment emphasis.
Yeah, and there's all these rules, as a forensic pathologist, you're out of your comfort zone. You come into this other world. It's their playground. You have there's rules and regulations, how you behave, which questions you can answer, where do you look. And all this adds to, nervousness, especially when you're somewhat younger. And it's suboptimal if you haven't trained that a bit, indeed in mock scenarios and had a few settings where you could just...
No mock scenario can prepare you for the real thing and the kind of the nerves you experience.
How significant is one's experience when presenting pathology evidence in court? Or for publication, but let's go with court.
Yeah, let's start with, court is thinking. There's already a lot to this question, because first of all, there's your experience as a forensic pathologist. So how good are you in your job? How much experience do you have with this type of cases?
Yeah.
So indeed, and that leads into how robust is your evidence. How well are you acquainted with the issues in such a particular case? I mean, stabbing cases lead to very different questions than shooting cases or infant deaths. So experience informs your practice and helps you with those nerves. I think also from the other side, the more experienced pathologist, and this should not be the case, but the more experienced pathologist tends to be believed easier. This is especially in the case in an adversarial system with juries.
Could I just cut in there?
Yeah.
If the juries are making the decision, how are they deciding that a forensic pathologist is more experienced or not? Might it not depend on how they present rather than their years of experience, or how?
So,
How many letters you have after?
Well, yeah.
yeah, so no, this is true, but the moment I mean, all court appearances I've done here, they first go through your CV.
Right.
So they know
Yeah.
exactly who you are, what your credentials are, how long have you been in practice. But you're right. But there is something about a older, seasoned forensic pathologist that knows how to use words, that has seen it all before, has this aura of knowing it all. And then there's the young consultant who might actually be more right, might have more robust evidence, but struggles a bit, stammers a bit, is more uncomfortable. And this is a thing.
Yeah.
This does happen. And so experience is important in the degree in which you are believed, but it also has to do with indeed how robust your evidence actually is. Experience is one of the most important sources of knowledge for forensic pathologists, but it can also be a source of great bias.
Might you be asked about evidence not related to the post-mortem, to something else, unrelated to what you're bringing to the table? Does that make sense?
So,
Like,
as an expert evidence, I mean, as an expert witness, you are bound by the fact. I mean, you have a special status as an expert witness. Normal witnesses can only give evidence about what they've actually seen. As an expert witness, you can also talk about your specialty and how it informs the case. So you have a special status. That, however, means that you can only comment on stuff that is within your area of expertise. The moment you stray outside of your area of expertise, you're no longer an expert witness. So therefore, you can't give that evidence. So this really revolves around what do you feel your area of expertise is. For instance, we use toxicology results in our reports and to formulate a cause of death. But I'm not a toxicologist. But I need to have a basic understanding of toxicology to be able to give those opinions. However, if it becomes really complex, I will refer to a toxicologist. So that is usually how you deal with that. You look at it, you're like, okay, is this forensic pathology? Do I think I have expertise in this? If not, then you suggest another expert witness. That can be a clinical doctor, it can be a toxicologist, it can be a microbiologist, whatever.